You're listening to the Holistic Nootropics Podcast, your home for holistic, evidence-based cognitive enhancement strategies. And now your host, Eric Levi.
Hey, what is going on, everybody? Welcome back to another episode of the Holistic Nootropics Podcast, where we talk about using nootropics, nutrition, and biohacking to help you hack the power of your brain. My name is Eric. I'm a nutritional therapy practitioner. And today on the podcast, I have Dr. Michael Platt. Dr. Platt, welcome to the Holistic Nootropics Podcast.
Well, hi there. Glad to be here.
Great to have you here, Dr. Platt. I'm very excited to chat with you today because I find you have a very interesting approach to holistic health and wellness. You're a licensed physician. You're been practicing for a long time, but you have a very what seems to be holistic approach to a lot of complicated disorders, especially pertaining to the brain. So I want to talk to you all about that, specifically about how you view things like adrenaline dominance and adrenaline's role in a person's overall health. But before I do that, I just kind of want to pick your brain a little bit and ask you how you came to such a unique perspective and a little bit about your background in the medical field.
Interesting question. Medicine has always been a passion for me. And I realized my mother developed breast cancer right around 1980. And I realized at that time that I had actually inherited her hormones. People don't realize that men and women have the same hormones. And that's when I first started getting interested in hormones. And people really don't realize that hormones control everything in the body. And in spite of this, doctors get very little training in hormones. In fact, doctors are not even trained to treat the cause of illness. They're just trained to give out Band-Aids. And that's neither here nor there. But the thing is that I realized that I had inherited her tendency to have too much insulin. And I also realized that I probably was low in progesterone because that's what caused her breast cancer. So that's what got me interested in hormones, and I try to find out as much as I could. But what happened is that I had an advantage that I was able to sit down with my patients for about 2 hours and talk to them. And as you probably know, history is 90% of a diagnosis when talking to a patient. And I've written several books, and if you ever, you'll notice in my books, there are no referrals in my books, because everything I've learned from talking to my patients, and it opened up a whole new world to me. And I'm a great believer in treating the cause of illness, and knowing hormones allows you to do that, actually. So anyway, that's basically it.
So you've pretty much come at this from, because everybody kind of has their angle, it seems like, in medicine, and I find the hormone thing to be real interesting because, like you said, so many doctors don't understand hormones. And I find even people like endocrinologists, who you would think their entire field is based off of hormones, don't understand these fundamentals of hormones, yet they control so much of what we do every day.
You're absolutely right about that. The doctors that probably have the least knowledge, I have to apologize to some of your listeners, but the doctors that seem to have the least knowledge of hormones are gynecologists. And they're the ones that treat women. And you're right, endocrinologists, they've been brainwashed by drug companies. So they won't go outside the evidence-based medicine parameters to getting people better.
So what do you think then is the most misunderstood thing? I know it's kind of a loaded question, but, if you could boil it down to a couple, kind of subtopics, what do you think is probably the most misunderstood thing about hormones?
Well, there's a lot that's misunderstood. A lot of people are afraid of hormones. You know, but you know, the thing is that when it comes to hormones, my least favorite hormone is estrogen, and estrogen to me is a very toxic hormone. It's beneficial to some degree, but it's also a very toxic hormone. And I think that the most misunderstood thing about hormones is related to estrogen, because you know they allow birth control pills, you know, to be sold. They still use estrogen to fatten animals like chicken and cattle, even though it's a known carcinogenic, you know, it causes cancer. And probably the least known hormone is progesterone, and it's an incredibly important hormone. And most people and doctors think that it's a woman's hormone, but men and women have the identical hormones. But progesterone is a hormone that actually helps to prevent problems related to estrogen. It blocks insulin and it blocks adrenaline. It's an incredibly important hormone. Anyway, I guess there's just a general lack of knowledge about hormones. And
yeah. I mean, because the hormone cascade, it's so vast, you know, the way that the hormones have precursors, and then they can kind of cross over in the things they do. And because they do influence so much, I would imagine, you know, this is where a lot of the misunderstanding comes from. And I have heard that estrogen it would make sense that it would be like the least favorable hormone to have. But progesterone, you never hear, you know, you hear about hormone replacement therapies, you know, women getting more estrogen, men getting more testosterone. But my knowledge of progesterone is that it's actually closer to the beginning of the whole cascade. So it would make sense that, you know, because progesterone, I believe, can make testosterone and estrogen. So you would want more progesterone if you can get it more naturally to help influence those a little bit more. Is that kind of correct? Or
it's sort of, yeah, you know, Pregenelone is the grandmother of all hormones.
Sure.
And Pregenelone converts directly into DHEA and progesterone, and all other hormones come from DHEA and progesterone. But the thing about progesterone, you know, aside from the fact that it causes cramps and PMS and breast tenderness, you know, it causes fibroids and endometriosis and polycystic ovaries, and it causes gallbladder disease, and it causes asthma, and it causes migraine headaches, and it causes...
That's estrogen, right?
Yes.
Okay, sorry.
Oh, it causes, you know, blood clots and phlebitis and 6 different cancers. I mean, to me, it's just a very toxic hormone. And the only reason a woman needs a high level of estrogen is if you're trying to get pregnant. That's the only reason. So when women enter the menopause, you know, what we have done, we've taken a natural condition called the menopause and turned it into a disease that had to be treated. And they treat it with estrogen. And nowadays, you know, doctors, you know, they're using pellets, which I don't approve of, but when they give women estrogen pellets, they put them on oral progesterone, and oral progesterone converts into a different hormone called allopregnanolone. So they're getting all these pellets, and they're not being protected with progesterone. Doctors think they're being protected, but they're not. So I'm just saying there's a lot of misunderstandings. But probably the number one hormone that is completely off the radar is adrenaline. And it's the underlying cause of so many conditions. In fact, a lot of these conditions have felt to be incurable. And yet you can actually cure them just by lowering adrenaline levels. And we can talk about that.
Yeah, let's talk about adrenaline, because I've heard you talk on other podcasts about this idea that adrenaline is behind not even serious diseases, but just kind of daily things that lower your quality of life. You know, for instance, it could be behind something like attention deficit disorder, or just general attention. I hate using ADHD or attention deficit disorder, because I feel like nowadays we all have at least a little bit, some degree of attention deficit. But I've heard you talk about adrenaline being behind, these things like ADHD or anxiety or depression or even physical pain. And I know this all kind of works alongside, your cortisol and your natural circadian rhythm. So maybe you can go in a little bit about how adrenaline fits into all that.
Adrenaline is a very powerful hormone. It's a fight or flight hormone, but it's a very powerful hormone, and it actually, you've may have heard of babies that have colic.
Yep.
Colic is all about adrenaline, and you can actually eliminate colic within 3 minutes just by putting progesterone cream on the baby's belly. And then you may have heard of the terrible twos. The terrible twos is all about adrenaline. And then next step is you may have heard of bedwetting in children, and the only cause of bedwetting in children is excess adrenaline, and that can be eliminated in 24 hours. And then we have ADHD, and there are millions and millions of people with ADHD, and it's a very misunderstood condition because it's generally thought of as a learning disorder. And ADHD is not a learning disorder, it's an interest disorder. In other words, if somebody has ADHD, they will focus on subjects they're interested in. If they're not interested, they will not focus. And the reason for that is that adrenaline as a neurotransmitter makes the mind go very quickly. And if they're not interested, they get distracted very easily. So, but the most intelligent, successful, creative people in the world have ADHD. So how bad can it be? And the fact that they treat it with drugs, and one of the side effects of these drugs is sudden death, by the way, but that's an acceptable side effect within our standard of care. But ADHD can actually be eliminated in 24 hours just by lowering adrenaline. I just find it almost reprehensible that, this is something that's been completely ignored. As you may, I've written a book called Adrenaline Dominance. And just to give you an idea, it's the only book that's ever been written that talks about adrenaline. And yet, you meant, one of the conditions that excess adrenaline causes is fibromyalgia. And fibromyalgia is felt to be incurable. But the thing is that all you need to do is lower adrenaline, and you can get rid of it in 3 days to 3 weeks at the most. I tell people with chronic pain that the best thing they can have is fibromyalgia because it's the easiest pain condition to eliminate. Even when people get cold hands and cold feet, they always blame that on a low thyroid, but that actually, the only cause of cold hands and cold feet is adrenaline. And, when people carry a lot of tension in the back of their neck, again, that's adrenaline. And the tense muscles can actually cut off blood supply to the ears, and you get tinnitus, or it can cut off blood supply in the head and cause a severe headache called occipital neuritis. And occipital neuritis is always mistaken for migraines. But the interesting thing is it's much more common than migraine headaches, and doctors know nothing about it. And these headaches can be eliminated within minutes just by putting some progesterone cream on the back of the neck. So, there was a time that I wanted to change healthcare in this country, but you run into so many, roadblocks. You mentioned at the beginning that I was licensed, but I surrendered my license about 11 years ago. I still have my MD, but I'm not licensed. And the reason the medical board had concerns is they had complaints from doctors. And doctors complained that I was taking their patients off their drugs, which is true. When you treat the cause of illness, people don't need drugs. Mm-hmm. And so I fought the medical board for about 3 years. It cost me about $500,000. You can't beat them. They make up all sorts of things. They never had a single complaint from a patient, but they had a number of complaints from doctors. And but the medical boards are completely funded by drug companies. So they used to be concerned about consumers, but now they're only concerned about the business of medicine. And they will eliminate those doctors that are not good for the business of medicine. And unfortunately, I was considered not good for the business of medicine because I take people off drugs.
Yeah. And that's the whole, this is the world I'm in as well. When you have a podcast called Holistic Nootropics, and each of those words takes away from the bottom line of pharmaceutical companies. I can definitely relate to you there. Actually, as we're recording this now, there's this big thing going on that the FDA has banned selling of NAC on Amazon. And a lot of people are afraid they're going to essentially make it classified as a prescription drug. You can only get it with the prescription from your doctor. So,
well, the thing about NAC, it does have some benefits for COVID-19. And, they're trying to eliminate anything that, they want people just to do vaccines.
Yep.
They don't want anything, you never hear a word about vitamin D. And, vitamin D prevents every flu there is. And it prevents people from getting sick from COVID, but you don't hear that. The 100,000 people that died in nursing homes probably could have been saved just by giving them vitamin D.
Yeah. And I
know this.
No, it's the more people can say it, I think it's the better. And I heard somebody say this the other day that, when they have the seasonal flu, back when we had the seasonal flu, it actually wasn't a seasonal flu. It was because it would happen in the winter. It was a seasonal vitamin D deficiency.
Well, I hear that, but the thing is that years ago, we lost the ability to convert sunlight into vitamin D. You don't hear that. But I'm in Southern California. I've never had a patient with a normal vitamin D level, ever. But 10,000 units of vitamin D will prevent every flu there is. And I can say that unequivocally with 100% assurance. So it won't prevent COVID, but it'll prevent people from getting sick from COVID, which is the same thing that the vaccines are doing.
Absolutely. And this is interesting that we made it to vitamin D. I wasn't planning on going here, but considering vitamin D, at least I've heard that vitamin D is more of a hormone than a vitamin. I'm wondering how this vitamin D then mixes with something like adrenaline and progesterone.
Well, we live in a country where they do not allow preventive medicine. I don't know if you knew that.
I'm familiar. Okay.
So vitamin D is great for the immune system. Adrenaline is not good for the immune system because it causes the body to produce cortisol when people are under stress, and cortisol is not good for the immune system. And adrenaline also shortens what are called the telomeres, which affects people's lifespan. So but I think it all comes together that it doesn't take a lot to get people healthy. It really doesn't. It's just a matter of treating the reason why they're not healthy. And unfortunately, that's not often done.
What do you think then is the biggest trigger for adrenaline dominance in a person? Is it diet? Is it lifestyle?
Well, the biggest cause of excess adrenaline is genetic. Mm-hmm. In other words, if one or both parents have excess adrenaline, the children will have it, and then their children's children will have it. In other words, if you ever have a child with ADHD, then one or both parents have it also. So the biggest trigger to excess adrenaline is genetics. But diet is incredibly important when it comes to the level of adrenaline that people have, it's probably important to mention why the body puts out adrenaline. Most people think of it as the fight or flight hormone. And so the body releases it in times of danger, but that's actually a very, very rare reason why the body puts out adrenaline. I mean, how often are we in danger? The most important function of adrenaline is to make sure that the brain has fuel. Most people do not realize that the brain uses more sugar than any other tissue in the body. And anytime the body detects that the brain is running out of sugar, glucose, it simply puts out adrenaline to raise glucose levels. So if people are eating in such a way that they're providing fuel to the brain, then right away that has a tremendous impact on actually lowering adrenaline. The brain only uses two different fuels. One is glucose. That's the type of sugar that it uses. And then the other fuel it uses are ketones. And people hear about ketogenic diet, which I don't recommend. It's a very hard diet to accomplish. But you can get ketones directly from coconut oil or the derivative of coconut oil called MCT oil. So people can very easily get, and the best source of glucose for the brain actually comes from vegetables. And the reason for that is that vegetables don't stimulate a lot of insulin. They're low glycemic. And, candy and soda are great sources of glucose, but they produce a lot of insulin, which lowers sugar level. So vegetables are the best source of glucose. And then you have coconut oil and MCT oil. And if people start adding that into their meal plan and using progesterone cream, which will block adrenaline, and in a 5% strength, I mentioned 5%, which means that each pump is 50 milligrams. And 50 milligrams is the exact strength that people need to block adrenaline. And so most of the over-the-counter progesterones are 2% or less, and they can actually even act like estrogen. They'll attach to estrogen receptor sites. So 5% is the ideal strength for progesterone for all things that it needs to do. And people eating correctly, and they can get well without seeing a doctor. Who have never heard of adrenaline anyway. So
what is the difference then between adrenaline and cortisol? Because I know cortisol has a very similar purpose, which is to make glucose available to, power your muscles, and your brain. But what is the main difference between the two?
Well, let me explain it to a different way. Adrenaline peaks to 2:30 in the morning. This is, when people, and the reason for that is that the brain runs out of fuel around 2:30 in the morning. And as soon as that happens, then the body puts out adrenaline to raise sugar levels. But adrenaline creates stress to the body. And the body responds to stress by putting out cortisol to deal with the stress. And then the first thing cortisol does, through a process called glycogenolysis, it produces glucose, which is different from the way that adrenaline produces glucose through gluconeogenesis, a little bit different. But here you have two hormones, adrenaline and cortisol, that raise sugar levels. And this is while people are lying in beds trying to sleep. And it is probably the number one cause of weight gain, because the whole thing about sugar, it doesn't matter whether you're eating sugar or if the body's making sugar. If you don't burn it up, then the body stores the sugar as fat and fat cells. So I'm pretty well convinced that this is the number one cause of weight gain, and nobody ever talks about adrenaline causing weight. Now, the thing about cortisol, it comes out to deal with stress, but it's not a happy hormone. It causes things like osteoporosis, and it damages the immune system, and it causes weight gain because of the rise in sugar level. So it's not a happy hormone.
Do you find that adrenaline, like high amounts of adrenaline, can essentially rob somebody of testosterone kind of in the same way that excess cortisol can?
Actually, I haven't noticed that.
Okay.
I have not noticed that. But adrenaline has a big effect on blood sugar.
Mm-hmm.
They have a test called the hemoglobin A1C. And when it's elevated, they tell people that they're pre-diabetic. Well, the most common reason for an elevated hemoglobin A1C is just too much adrenaline. Remember, it keeps on raising sugar levels. And so all these people that are told they're pre-diabetic are not pre-diabetic. They just have a lot of adrenaline. And even when people actually do have diabetes, excess adrenaline can obviously exacerbate that, just by keeping, raising blood sugar level. So it's just that adrenaline is just not thought about or talked about. And eventually it will be. If they have no other choice, they're going to have somebody's going to start having to recognize adrenaline.
Yeah, and basically your solution for it is progesterone cream. And so I'm curious how you What was your first foray into using progesterone cream, and how you figured out that this was actually something that works in the clinical setting on your observations?
I don't even know if I have the answer of that. I've been working with progesterone for a long time, and it was probably the fact that I realized that a number of people that I put on progesterone benefited from getting rid of other problems that they're having. You remember, I'm not a scientist, so basically everything I've learned is just observational, and but when you're dealing with literally thousands of patients and they all get better by in terms of their ADHD or this, that, whatever. I've never had a patient with fibromyalgia who did not get better. So I can only assume that it's the adrenaline that is, blocking the adrenaline receptor sites. Then that's what progesterone does. That it's helping.
And it sounds like the progesterone, it sounds like you can almost say that, at the heart of these problems is adrenaline, because I know you're not a scientist. I'm not a scientist either, but using kind of like a scientific method, if we believe that progesterone can block adrenaline dominance, and you use progesterone for these people that have these issues that they're definitely not coming to you thinking that it has anything to do with adrenaline. They've probably heard from other doctors that it's, they have fibromyalgia because, of this reason, or they have diabetes for that reason. And then you give them this progesterone and then you see their issues, they feel better. Then I think it's safe to say that there is something behind that mechanism. Your hypothesis is certainly, at least seems to be proven.
I had a patient who was in his 40s who came to see me. And the one thing he complained about is that every morning he would wake up and vomit. And the only thing that will cause that kind of vomiting is adrenaline. There's nothing else that will cause that. And needless to say, he also had severe fibromyalgia. So I put some progesterone cream on him, and we started talking. And 5 minutes later, he sat back in his chair, and he looked at me. He said, "Doc, in my entire life, I have never felt this good." That's within 5 minutes. He never had another episode of vomiting after he left my office. And his fibromyalgia, of course, disappeared. But the thing is, it's very rewarding to get people better, having, to improve the quality of their life. And unfortunately, doctors don't see it, as often as they really should. You may have heard of women that vomit throughout their entire pregnancy. Again, that's also adrenaline. And they have something called cyclical vomiting syndrome in children, where they have to wind up in the hospital because they can't stop vomiting. This is all adrenaline, and it's completely off the radar of doctors. Why is this? I mean, it's not that hard to figure out.
Yeah. Maybe because there's not a test for it. Or is there a test for it?
Well, the best test is actually a morning cortisol, a blood test. Morning cortisol, because remember, the adrenaline comes out, it causes stress, the body puts out cortisol to deal with the stress. So a morning cortisol blood test, not a saliva test, a blood test, before 9 o'clock is the best test for elevated adrenaline. But you can't go by the normal level. And the reason for that is that they use doctors or medical students to figure out what the normal levels of cortisol should be. But all doctors have increased adrenaline. All doctors.
Oh, wow.
So the levels of cortisol, the normal levels are too high because these people have a lot of adrenaline. So the normal level goes up to 19.4, but anything above 13 should be really considered high.
And you were saying that that adrenaline peaks at about 2 o'clock in the morning. 2:30. Okay. So I would imagine that this could maybe be behind some people's sleep problems.
Oh, it's the number one cause of insomnia is, and there's something called restless leg syndrome, which you can get rid of in 30 seconds. People that toss and turn, people that grind their teeth at night, that's all adrenaline. People that get up at night to urinate, is mostly adrenaline. Could be the prostate, but it's usually adrenaline.
Sure. So if somebody came to you and then you suspected they had an adrenaline issue and their main complaint was sleep, would they use progesterone cream at night before they go to bed?
It's the best time to use it. And I have people eat something before they go to sleep, because remember, then the body puts out adrenaline to raise sugar levels for the brain. So I recommend that they eat something like leftover vegetables right before they go to sleep, and use some progesterone right before that, and they'll sleep throughout the whole night.
And what's the best way to apply progesterone?
Well, normally, again, we're talking about a 5% strength.
Mm-hmm.
Okay, that's important, because that's the strength you need to block adrenaline. So one pump, put on the forearm, you rub the two arms together. That's the best place.
That's the back of the forearm, like here, or the front?
No, the front.
Okay.
The inner forearm.
Uh-huh.
Those people that carry a lot of tension in the back of their neck, that's another really good place to put it. If they have restless leg syndrome, I have them massage it into the top of their thighs. If they ever get cramps in their calves or feet, then again, to massage it where the cramp is, will go away in about 30 seconds. And it's safe for babies. When the fetus is in the womb, it's exposed to incredibly high levels of progesterone. So it's extremely safe to give to babies with colic. You can't harm them with it. And you can use it for children that are bedwetters, along with eating correctly. It'll go away in 24 hours instead of years that they have to deal with it. The point is, it's not hard to get people well. It really isn't. You just have to treat the reason why they're not well.
And it's okay for guys to take this? Because I know progesterone it's a mostly women dominated product, especially for women who are trying to get pregnant. But men, it's okay for a man. It won't mess with their testosterone.
No, not at all. In fact, it'll help with because it blocks estrogen. Mm-hmm. It'll actually make testosterone work better. But if men and women had the identical hormones, this is not a woman's hormone, different levels. But men stop making progesterone right around the age of 50. It stops, and that's after that is when they start developing prostate cancer, because they have no protection anymore from estrogen, and men wind up with higher levels of estrogen than women ever, after the menopause.
Does using progesterone affect the natural production of progesterone in any way?
It doesn't, because there's no such thing as a progesterone stimulating hormone. So no, it won't affect it at all.
Okay.
And people should, I don't know if they need to know this, but adrenaline is both a hormone as well as a neurotransmitter. And the hormone, when you talk about kids with ADHD, this is why they're hyperactive. But I talk in my book, Adrenaline Dominance, I talk about the good, the bad, and the ugly. And the only thing I put in the good section was ADHD, by the way. Because, like I say, the most intelligent, successful, pretty people have ADHD. But there's another type of ADHD called ADD. And these are kids that have trouble focusing, but they're not hyperactive. But these are what I call the creative type ADHD. These are creative type children or adults. And if people with creative type ADHD have the most adrenaline, actually. And the way people would know if they're a creative type person is that creative people are very intuitive about other people. They can pick up good energy and bad energy. And they often have premonitions and deja vu type feelings. And they'll also find that animals are very attracted to them. Creative people attract animals. But, and there's a reason for that. But, dog whisperers and horse whisperers are the ones that have all this adrenaline. And adrenaline is a neurotransmitter, allows them to tap into the energy that goes through the air. A lot of energy from cell phones and Wi-Fi and satellite. So because they can tap into that energy, this is why they're very intuitive, they have premonitions, but animals can sense that energy, they're very attracted to it. And clairvoyants and psychics, this is how they do their job. So adrenaline, there's some interesting facets to it.
Yeah. I mean, it sounds like it definitely has its place in our physiology, but it just seems like nowadays, whether it's genetic or it's, because of your lifestyle, I'm sure there's a trauma element to it as well. It just seems like it's just so overwhelming these days, more than it's probably supposed to be.
There's only one downside to progesterone. Have you ever heard the term type 3 diabetes?
Yep.
Okay.
Alzheimer's.
Well, it certainly can predispose to Alzheimer's.
Yep.
And this is the other term for that is insulin resistance in the brain.
Mm-hmm.
And so people that have type 3 diabetes cannot tolerate progesterone. And the reason for that is that progesterone, because it does create some degree of insulin resistance, which is it's a good thing because it prevents people from getting sleepy in the afternoon when insulin peaks and prevents people from getting sleepy when they're driving. But if people already have insulin resistance in the brain, type 3 diabetes, and use progesterone, it makes it even harder to get glucose into the brain cells. So there's an immediate release of more adrenaline. And, what's interesting, they don't have a test for type 3 diabetes. There is no test for it. But if somebody uses progesterone and they all of a sudden get an outpouring of adrenaline, they have type 3 diabetes, or you certainly have to look for that.
Certainly sounds like something like progesterone can be used for, a lot of people who are going down that mainstream medicine, on and off ramp and, want to find a way out, but just cannot find that thing that can help support what they have. And it sounds like progesterone, by lowering your adrenaline dominance, can certainly have an effect for whether it's, some of these more physiological fibromyalgia, autoimmune disorders, all the way up to, ADHD, depression. It all has an adrenaline component.
Yeah. Anxiety. You mentioned depression. There are basically two different types of depression. One is reactive, where people lose a job or somebody dies and they react to that. But there's an endogenous depression. This is a depression that comes from within. And the most common cause of that is internalization of anger. And adrenaline is the anger hormone. And so it's probably the number one cause of endogenous depression. But anxiety goes away immediately. Women with what they call an overactive bladder, they have to run to the bathroom and they get leakage or something like that. Again, that's adrenaline. Except some women are now getting Botox injections in the bladder, which means for the next 3 months, they have to self-catheterize themselves. Wouldn't it be easier just to use some progesterone cream and get rid of it? I don't know.
We are coming up to the end of our call here. Before we sign out, is there anywhere, if somebody's listening and they'd like to work with you, or I think you mentioned that you have your own progesterone cream product, that somebody can find this. What is the best way for somebody to stay in touch with you, Dr. Platt?
Well, I have a website. It's www.plattwellness, Platt, plattwellness.com. And I have my, a excellent progesterone product on there, and my books. And if they need to they can always call the office, which is 760-836-3232, 760-836-3232. If they have questions, but I always enjoy answering questions so that they won't be bothering me.
That's good to know. And we'll put all those links and everything in our show notes. It'll be on our website along with the show page for this episode of the podcast. Well, Dr. Platt, this has certainly been an enlightening chat. I've learned a lot about progesterone, estrogen dominance. I might go slap a little progesterone on tonight and see if it helps my sleep. I certainly appreciate your time. Thank you so much for joining me today.
One last thing.
Sure.
Progesterone is good for dogs. Dogs that have separation anxiety, and all they need to do is put it inside the ear, which is like skin. It'll go away in about 1 minute. So. Okay.
So that's good for like the dogs who bark a lot when you leave and scratch up your door, and
or dogs that are aggressive,
Okay.
Adrenaline. Okay.
Wow. Well, there you go. Get some, if nothing else, get some for your dog. Save those scratch marks and having to return your security deposit or not getting your security deposit from your landlord.
Exactly.
Yeah. Well, Dr. Platt, again, thank you so much for joining me today. And listener, be sure to check out the show notes to this podcast and every podcast that we've recorded at holisticnootropics.com. That's where we'll have the show notes to this podcast and all the podcasts that we have. And until the next one, thank you so much for watching. We'll catch you on the next podcast. I don't know how to sign out of these things. How do we do it, Dr. Platt? We'll catch you in the next one. Peace.